Let's bring in Kelly Wilson Cull, the Director of Advocacy for the Canadian Cancer Society. Kelly, thank you very much for joining us today.
Good morning. Thank you.
Those are some disturbing numbers. I mean, we have a publicly funded healthcare system, but boy, oh boy, when you're in it, you're also dealing with a lot of other expenses.
It really, really is alarming, and it's an opportunity here on World Cancer Day to really raise the gaze and kind of look at the issue of affordability and the economic impact of cancer in Canada. And as you said off the top, I think that there's an assumption that here in Canada we have a universal health care and that things are covered. And you know, we deal with and hear from everyday cancer patients who are struggling to make ends meet in the context of their cancer diagnosis. The other piece that we're really working to shine a light on through this survey released today is that among working age Canadians, about 80% indicate that they would struggle to save for retirement if they were faced with a cancer diagnosis. And that really goes back to what you've talked about, is the alarming out-of-pocket cost expenses associated with the diagnosis. In December of last year, we released a report that estimated that the average Canadian spends about $33,000 in their lifetime on their cancer. And so this can be quite devastating from a financial point of view.
And how can we help these people? What can we do? I mean, we have things for kids who are getting treatment. We see Ronald McDonald House, but you don't really think of anything like that for adults because we just assume they can take care of themselves. How can we help these people?
You know, certainly this really is a whole of society concern, and it's something that should concern all of us because cancer impacts so many Canadians. About 2 in 5 Canadians are expected to be diagnosed with cancer in their lifetime. And particularly among working age Canadians, some people are surprised to know that about 40% of all diagnoses in Canada happen during the working years. And we're seeing two trends. We know that there are more young people who are being diagnosed with cancer, and at the same time, more people are surviving cancer and then returning to the workforce. So it's really an imperative on all of us, and that includes governments, that includes policymakers, it includes charities, industries, and workplaces to be ensuring that people can build a stable financial future while they're receiving a cancer diagnosis and possibly taking time away from work to receive that treatment and recover the way that they so desperately need to.
And just one last question. We talk about, you know, the lost wages that people often are hit with. What are some of the surprise costs that people may not think of if they have to face a fight with cancer?
Sure. One of the other kind of key findings of this survey, again, among working age Canadians, about almost 30% of working age Canadians indicated to us that they felt that they would be likely to lose their job in the context of a cancer diagnosis. And so it really is this double-edged sword of an increased rise in expenses and then the loss of income. We're calling on all levels of government to work together to solution this issue. There are levers that can be applied at the federal level. An example would be the Canada Caregiver Credit, making that refundable so that it's more accessible and meaningful, particularly to low-income people. At the provincial level, there are just a number of ways that provinces can be supporting cancer patients. This can include things like ensuring there's comprehensive drug coverage. Again, some people assume that all of their cancer drugs are covered and are surprised to learn that many are not publicly funded. And this varies province to province, depending on where you live in Canada. Also, out-of-pocket supplies, things like wigs and prostheses, ostomy supplies. These can all add up, particularly when you're faced, of course, with a loss of income and a rise in expenses. We're also calling on all provinces to implement job-protected leave so that people can take that time away from work, knowing that their job is legally protected while they receive their treatment and recover.
Okay, Kelly, thank you very much for joining us today.
Thank you.
Kelly